In the 17th century, medical treatment was as dangerous as the illness itself. Surgeries were performed without anesthesia, antiseptics, or reliable knowledge of anatomy. Few procedures were riskier than lithotomy, the removal of bladder stones. Patients often died from blood loss, shock, or infection. Against this backdrop, one Dutch blacksmith named Jan de Doot made history by taking matters into his own hands, quite literally. His story is one of the most extraordinary acts of self-surgery ever recorded. Bladder stones were agonizing. They caused constant pain, difficulty urinating, fever, and sometimes death. In Jan's time, physicians performed operations using crude instruments, and their reputation was grim. De Doot, like many, distrusted the medical profession, which was notorious for botched surgeries and high mortality rates. For him, enduring the agony of the stone was unbearable, but trusting a surgeon was unthinkable. His solution was almost unthinkable too. He would operate on himself. According to accounts in 1651, Jan prepared himself by sharpening a common kitchen knife and waiting for the right moment. With immense courage, he made an incision in his lower abdomen and cut into his bladder. Guided by pain and determination, he located the stone and through sheer force extracted it. The stone, described as being the size of a chicken egg, was so large that it later became a curiosity preserved in the collection of the Museum Boerhaave in Leiden, Netherlands. Even more astonishing than the act itself was the outcome. Jan survived. At a time when even professional operations often ended in death, a blacksmith using a dinner knife succeeded where trained doctors might have failed. His self-surgery was later immortalized in art, most famously in a 1655 painting by Karel van Savoyen, showing Jan proudly holding both the knife and the massive stone he removed. Historians debate the details, whether Jan had some assistance, how much of the story was embellished, and whether this was his first or second attempt at self-surgery. Regardless, his tale was circulated widely as a symbol of extraordinary bravery and distrust of the medical establishment. For contemporaries, it was a testament to human willpower and the idea that common men could outwit both pain and doctors. Today, Jan de Doot's operation is recognized as one of the most extreme cases of self-surgery ever documented. Standing alongside modern accounts of explorers and doctors forced to operate on themselves in remote conditions, his case reveals both the horrors of pre-modern medicine and the desperate lengths people would go to escape suffering. The blacksmith's legacy is not just the gruesome image of a man cutting into his own body, but also a reminder of how far medicine has come. What once required a knife, courage, and unthinkable pain can today be resolved in sterile hospitals with anesthesia, antibiotics, and skilled surgeons. Jan de Doot's story is shocking, but it underscores the resilience of human beings in the face of unbearable suffering.